Age-friendly care is focused on enhancing care for older adults and their families. And it is done by implementing this evidence-based framework called the 4Ms framework. And this framework was put together with the John A. Harvard Foundation, the Institute for Healthcare Improvement, and the American Hospital Association. So we work together to create this 4Ms framework, which can be implemented and it should be tailored to any care setting. And the 4Ms are what matters, medication, mentation, and mobility.
And the outcomes of that effort are pretty significant. When you look at what's been published on the work that's come out of this partnership on the 4Ms, it has improved patient experience measures. It's improved length of stay. We've seen reductions in falls. We've seen changes in cost of care. And those outcomes can't come fast enough.
When we think about defining what matters most, this question allows for a discussion to open up between us and our patients. That way we can get a better understanding about what's most important to the person that we're seeing, their family, and their caregivers.
When patients come to us to see us to get better, they leave with a prescription. This prescription is going to make patients feel better. And so now asking our colleagues, our learners, to think about medications differently requires a lot of change. Ultimately, as you think about your initiatives, as you're starting out, small successes will give rise to bigger successes. Think about starting small, think about scalability, think about what you can track, and build on that momentum because that will give you sustainability.
Dementia, delirium, and depression. And what we know is that these conditions often overlap, as well as one of the conditions can also be a risk factor or an outcome for the others. All of these conditions do have some preventability in them. We know up to 30% of deliriums are actually caused by us, by the things either we do or that we fail to do. And those are all incorporated within the 4Ms.
The first thing we did was really an inventory of equipment and ourselves. So did we have enough chairs? Did we have enough walkers for people to actually move? And then did the staff think it was even important? So we had staff set the chairs up the night before for the morning. So what that means is whatever your organization does, put a sheet, a pad. So as the patients got up in the morning, if they needed a toilet, it would be a natural progression. Let's go ahead and sit in the chair. It's already set up. And we did see a good success, and our rehab services partners were really pleased with that.
I think that the learnings that we're getting from each other, having conversations about how to break down silos, how to gain executive sponsorship, how did that go at each of our different sites? We come from different areas of the country. We come from different size hospitals, different outpatient clinics. Our journey is different, but our goals are the same, and that is taking the best care of our over 65 population that we can.
I'm able to work with other people that have the same passion around wanting to do the age-friendly work for their health system and across their organization.
We have an aging population. It is very important that we take good care of our older adult population, not just in the hospital, in outpatient, but in everywhere, in every healthcare settings. So I urge everyone to join the action community to better take care of our older adult population.